When you are pregnant, your body goes through a lot of changes. Sometimes these changes can cause problems for you and your baby. During pregnancy, some women develop a special type of diabetes called gestational diabetes.
ಡಯಾಬಿಟೀಸು ಎಲ್ಲರಿಗೂ ಬರುತ್ತೆ, ಗಂಡಸರಿಗೆ ಹೆಂಗಸರಿಗೆ ಮಕ್ಕಳಿಗೆ ಎಲ್ಲ. ಜೆಸ್ಟೇಷನಲ್ ಡಯಾಬಿಟೀಸು ಬರೀ ಪ್ರೆಗ್ನೆಂಟ್ ಇರೋರು ಗರ್ಭಿಣಿಯವ್ರಿಗೆ ಮಾತ್ರ ಬರೋದು.
Your body produces something called insulin, which controls the level of sugar in your blood. Because of changes occurring in the body during pregnancy, in some women, the insulin can't work properly. As a result, the level of sugar, sometimes called glucose, in your blood can get too high. This is called gestational diabetes. If your blood sugar is too high, it can be harmful to you and your baby's health. The high blood sugar can result in your baby growing too large, making birth more difficult. It can also increase the chance that you and your baby will suffer from diabetes later in life. Gestational diabetes can be treated, reducing the risks to mother and baby. However, it can only be treated if it is diagnosed. You are more likely to get gestational diabetes if you are overweight, if one of your previous babies was larger than average, or if you have family members with diabetes. However, any woman can develop the condition during pregnancy. Because most women with gestational diabetes do not have any symptoms, it is important that all women are tested for the condition as early as possible in their pregnancy. To test for gestational diabetes, we use a test to see how well your body uses sugar. The test will involve drinking a sugary drink and then having a simple blood test taken 2 hours afterwards to test your glucose or sugar level. The test should be done on all pregnant women. It should be done for the first time early in your pregnancy and then again later in pregnancy, around 24 to 28 weeks. Although it is best to do the first test as early as possible, a test can be done at any time during pregnancy. If you have not yet had a test, ask your doctor. During pregnancy, you should aim to take regular exercise and eat healthy foods. This is very important for a healthy pregnancy, even if you don't have gestational diabetes. For the first 3 months of pregnancy, you don't need to eat any more food than you did before pregnancy. From the 4th month, calorie intake can increase by another 350 calories a day. It can be helpful to eat smaller meals more often, maybe 3 meals and 3 snacks each day. Healthy meals must include plenty of vegetables and fruit, as well as food that gives you protein, like eggs, meat and fish, and dairy, like milk, curd and paneer. One important food group is called carbohydrates. Everyone needs carbohydrates in their diet. These foods give you energy. You should try to choose healthier types of carbohydrates. Healthy types of carbohydrates are brown rice, wheat, ragi, bajra, and jowar. Try to limit less healthy carbohydrates such as white rice, pasta, noodles, white bread, breakfast cereal, and biscuits.
ಪ್ರೆಗ್ನೆನ್ಸಿಯಲ್ಲಿ ಡಾಕ್ಟ್ರ್ ಹೇಳ್ತಾರೆ ನಿಮ್ಮ ಮಗಳಿಗೆ ತರಕಾರಿ ಸೊಪ್ಪು ಅದು ತಿನ್ನಿಸಿ ಸ್ವೀಟ್ ಕಮ್ಮಿ ಕೊಡಿ, ಜಾಸ್ತಿ ಕೊಡಬೇಡಿ, ಟೀ ಕೊಡಬೇಡಿ ಅಂತ ಹೇಳ್ತಾರೆ. ಡಾಕ್ಟ್ರ್ ಹೇಳಿದ್ದು ನಾವು ಪಾಲಿಸ್ತೀವಿ.
Keeping active during pregnancy will benefit you and your baby. Being active for 30 minutes a day is the best way to control blood sugar levels. Regular exercise and eating healthy might be enough to keep your blood sugar under control. A small number of women who are diagnosed with gestational diabetes may need to take medicine. This might mean you have to take tablets each day or give yourself injections. It might sound scary, but women quickly get used to it. The medicine is safe for you and your baby and will help to keep your blood sugar under control. In most cases, you can stop this medicine after your baby's birth. If you are diagnosed with gestational diabetes, it is normal to feel stressed and anxious. Try to stay positive. Ask your family to support you to make healthy lifestyle changes.
ಲೇಡೀಸ್ ಬಂದುಬಿಟ್ಟು ಇದು ನಾನು ಮಾಡಿರೋ ತಪ್ಪಿಂದನೇ ಶುಗರ್ ಬಂದು ಅಂತ ಅನ್ಸ್ಕೊಳ್ಳೋದು ತಪ್ಪು.
Gestational diabetes is a common condition and can cause problems for you and your baby. Be aware of the condition and make sure you are tested for it. If you are diagnosed with gestational diabetes, it can be treated. Pregnancy is a special time in a woman's life, and it is important to do all you can to stay healthy. Eating well and keeping active is important for all pregnant women. It will help to keep you and your baby healthy.